ladies, it's Andrea from Fabulous at 60. Be fabulous at any age. We're back with Dr. Laura Corio. Say hello,
Hi,
ladies.
how you doing?
And today we're going to be talking about breast cancer awareness because it's Breast Cancer Awareness Month. And we want to discuss what you guys should really know, but what we'll learn again from Dr. Corio. So take the floor, Dr. Corio. Talk to us.
Okay, so first of all, we really believe that mammograms and breast sonograms and even MRIs of the breasts are saving lives. And we still feel very strongly about the recommendation that a woman should have a baseline mammogram between ages 35 and 36. And then when she gets to 40, we are still recommending yearly mammograms and breast sonograms for women with dense breasts till for the rest of their lives, yearly. Now, there's a lot of controversy that has come out on the recommendations for mammograms. When I speak to women all the time, they're always confused. Am I supposed to do it once a year? Am I supposed to do it twice a year? Once every 2 years? Once every 3 years? A patient just asked me, because every time a new recommendation comes out, women get very confused. And honestly, the American College of Obstetrics and Gynecology, as well as the American College of Surgeons, has not changed their recommendation and still recommends that women should get mammograms yearly after 40.
Once a year after 40, ladies.
Now, what's really important also is that mammograms get better as a woman ages. So the woman who's in the premenopausal years who has fibrocystic and dense breasts will always benefit from a mammogram with a breast sonogram. But when a woman goes through menopause and they're not on hormone replacement therapy, the breasts become fattier. And they do better with just a mammogram. Believe it or not, an x-ray really can pick up breast cancer. Now, a lot of people also say to me, Laura, every time I go for a mammogram, I hear that I need a breast biopsy, or they seem to do a lot of biopsies and it seems unindicated. Well, the problem is that, if you can diagnose breast cancer early, you're going to make such a big difference in your morbidity and mortality. And so if they have to biopsy, they're really doing it to make sure that it isn't. And yes, 4 out of 5 biopsies will come out negative, but that 5th biopsy that comes out positive and could save a woman's life by doing early intervention versus the woman who may not go to the mammogram for years and then have a mass and have positive lymph nodes and not do well. We know that breast cancer is the #1 cancer in a woman, and we know that it's the second cause of death in a woman as far as cancer. Okay, so breast cancer is #2 as far as cancer. So there's a percentage of women who are considered high risk because they have family histories of breast cancer in a mother or a grandmother or an aunt earlier than 50. So those women have to really be watched more carefully, and the gene testing, the BRCA, the BRCA1 and 2 would be very good for them to have done to see if they are positive or negative. But the rest of the breast cancers, not 15%, but another 85%, seem to be environmental.
Really?
And we can talk about some of the ways that a patient could reduce their risk of breast cancer in the environment. For instance, one of the most important things is weight. And I really talk to my patients about trying to keep their weight down, because it seems that postmenopausal breast cancer is increased with obesity and weight gain, especially in your perimenopausal years. So exercise, you're fabulous at 60. We need to do exercise. Exercise really will decrease your risk for breast cancer. Another thing that we should look at is alcohol. It seems that, no, I'm really serious, it seems that alcohol can increase the risk for breast cancer. When we talk to patients all day, I talk to them about the fact that 1 glass of alcohol a day is very good for your heart, but 2 glasses is bad for your risk for breast cancer.
Whoa, I didn't know that.
And that's daily.
That's scary.
Yeah. So, the wine that you kind of drink 1 glass and then you say, oh, I'm going to have a second, and then you might even have a third. I really tell my patients to think more carefully about the fact that alcohol will increase your risk for breast cancer. So that's another reason. Vitamin D supplementing, very important. They seem to feel that women who are diagnosed with breast cancer in their premenopausal years and then take vitamin D will decrease their chance of getting a recurrence in their postmenopausal years. Okay? So exercise is important. Weight gain is really not a good thing. Alcohol, vitamin D. women who breastfeed seem to decrease their risk for breast cancer, and women who have babies at a younger age rather than an older age seem to do better as far as breast cancer as well.
So that's a lot of information to get. We got a gazillion-dollar visit here. Thank you, Dr. Corio.
You're welcome.
And ladies, don't forget you can buy your vitamin D on my site, but I recommend you to be tested by a physician before you buy it and know how much you should be taking. You could be taking too much or you could be taking too little. So goodbye for now from Dr. Laura Corio and Andrea at Fabulous at 60.